Hello again, I'm Tony Mecham, oral maxillofacial radiologist, and today I'm going to be talking about image interpretation basics. This is kind of the psychology behind image interpretation, and I'll talk a bit about how our brains interpret images and how we're equipped to interpret what we're seeing with our eyes. So let's talk a little bit about image perception, how we see images. How many triangles do you see in this image? Give you a second, look at that, start counting. And how many actual triangles are there? The answer is 0. There's 3 V's, but our brains make up what we're not seeing here, and it looks like this 6-pointed star because of what's missing here. And so we rely a lot on pattern recognition instead of just analyzing individual components. That's how we're able to see and determine what we're actually seeing. Our brains actually give us an overconfident belief that we're taking in everything that we see from our surroundings. But if you really zoom in on one individual part, your brain is recognizing a lot less than what's actually there. But this can be beneficial as we start recognizing patterns. For example, this sort of ink blot image, you can probably all recognize that looks like a dog. Now, individually, each of these pieces doesn't really look like a dog, but our brain is able to put together a pattern and it looks like the pattern of a dog. How about this one? Kind of an illusion, or kind of putting together different patterns. This is an elephant. Its head is up here, its body is around here, its 4 legs, and its trunk. This one might be a little more difficult, but you may be able to recognize the pattern. This is a ship, kind of a steamboat, where the bow is coming toward you like this. This looks like the water. And so the less detail you see, the harder it is to put this together. But like a lot of these things, once you see it, you can't unsee it. And that's kind of how our brains work. Once it sees the pattern, it puts it together and interprets what's actually there. All right, what about this? You probably all recognize the circle of blue within the lines. And you probably look at this and it doesn't look like too complex of an image, right? But what if I gave you a piece of paper, a piece of blank paper, and I gave you a black and cyan pen, and I told you to recreate this? Now, you could probably do a good job of recreating a circle in the center of the image, but to recreate every single line in the same pattern that is showing here, that would be basically impossible. And so our brain skips steps. It skips in looking at every single part of an image and just takes what we're familiar with. For example, you may be able to recognize who this is. And it's pretty pixelated, so maybe it's a little difficult, but I figure most people can probably tell who that's supposed to be, and especially it'll help you if I put his best friend here right next to him. A little bit more detail. We probably all appreciate now that that's Joe Biden, and that was Donald Trump. And so I like this quote: "The eye cannot see what the mind does not know." And if you look at this image, for example, immediately you see these guys sitting and leaning against a wall. You know, everything's hunky-dory. This guy's reading a paper. Then you start looking around, and what are those people doing up on the wall, standing sideways, and you realize, oh, well, this is the original image. This is how it should be. But of course, our minds just put things how we expect them to be. And we can see half an image, and our mind kind of fill in the rest of the half. Here's a lady at work. We see her coworker here, Ray. All right, nothing wrong there. This is actually the original image. I split in half and put one in mirror image. This is one of the better Halloween costumes you'll ever see. But our brain tries to fill in what we don't see with what we're familiar with. And here's an example of the effect on contrast on how your brain sees things. You've probably seen an illusion like this before. And so maybe you know, looking at these squares, each of these is actually the same color. It's the same color of gray, even though that one looks darker because the contrast of the lighter background around it, and this one looks a lot lighter. And if you look at this one now, with the contrast of the background behind it, it looks darker on this side, lighter on this side. And this is exactly what we're going to see when we get into image interpretation, specifically looking at caries. And on the border between dentin and enamel, you get what's called mock band effect, which creates an artificially dark line along that border near the enamel. And that's basically what we're seeing here. So our eye kind of fills in areas to be darker or lighter, and that helps us see boundaries. It helps us detect patterns, but it does also create illusions. And in the case of mock band effect, it can lead to false diagnosis. And so that's something you need to pay attention to, and we'll get back to that when we get into caries diagnosis. Here, I was playing around with this too. What if I told you I can change the color of these gray squares to green? Now stare right at the star, right in the middle. Count to about 10 as you do that, and don't move your eyes. So I'm going to flip back to the previous slide, but keep your eyes fixed right on where that star is. And you'll see color emerge in those squares now. And the words on top also, they look green. So they've taken on that green appearance behind them. Just another little illusion, but shows kind of the effect of contrast. So just realize there's a lot of things going on with your eyes and a lot of steps that take place before we actually interpret what we're seeing. And so we need to be aware of those and not be tricked by different things. For example, context. So here we have the letters A through F, the numbers 10 through 14. What's this right here? Was this a B or was it the 13? Or does it depend on the context, what you should make of it? And the same occurs in radiology. When we see things in the sinus versus when we see it in the jaw, it's going to tell a different story. So we do need to understand what makes a radiograph, and that's just X-rays passing through different objects. As it passes through air, these lines represent that very little of it is getting attenuated. It almost completely passes through air. What's that going to look like on the receptor? If you just take an image and the X-rays shoot through air, it's going to be very dark. So the more X-ray exposure to the film or the sensor, the darker the image is going to be. And so bone we know is going to be lighter. It'll block out most of the X-rays, but not all. And then metal will contrast with bone. So amalgam is really going to show up as very white because it blocks essentially all of the X-ray photons to where you get a very light image. And so the more dense a material is, the lighter the image is going to be. We call that radiopaque. Here's our example right here. Enamel we know is very dense, at least as far as body tissue is concerned. It's the densest object there is, but this amalgam filling is even more dense. And so that's what we see here. Blocking out all of the X-rays, you get basically just a white image. And then varying degrees, depending on the thickness, depending on the density, we get cortical bone that's more dense than marrow space, trabecular bone. And so that's why it looks the way that it does. All right, I thought this was a good little practice to kind of imagine how things are going to look in an X-ray. And so we have these cylinders made from plaster of Paris. And in this rotated view, you can see that this is a solid cylinder. This one has a narrow hole cut out of it. This one has a wider hole cut out of it. And this has kind of an X-shaped or a plus-shaped hole cut out of it. So what are those going to look like radiographically? Are they all going to look the same? Maybe you can kind of imagine what they look like. But now try to match these to these. The first one may be easy, right? That's the solid cylinder. You get a little more radiolucency on the side where the X-rays are passing through tangentially. All right, which one is B with this narrow cylinder? Hopefully you recognize that right here. It has sharp edges because the edge of our cylinder are fairly sharp. And then which one is C? That'll be this next one with a large cylinder cut out of it. And then this is the one with the X or the plus shape cut out of it. As you can see, a very small, narrow cylinder where it's really radiolucent. And then you get kind of these steps, as you can imagine, as you're X-raying through more and more of the plaster of Paris, it's blocking out more of the radiation. All right, so you've seen what plaster of Paris looks like. And maybe I'll point out, this looks a little bit less dense than this. Both of these cylinders look very dense. So I want you to try to guess what type of material these are and what the shape is. So if this is a little bit more dense than plaster of Paris, then this is a metal cylinder. There's your first hint. This one, you see a radiopaque outline here, so hollow in the middle. And this is just a plastic cup. And this one, what do you think? More dense or less dense than plaster of Paris? So it's quite a bit less dense than plaster of Paris. And that is just look at it here, this is a wood cylinder. And so we had our plaster of Paris, we had this plastic shaped cup. That's why you see the cup shaped outline to it. These of course are imaged on the side like you're imaging from this direction. Your solid metallic cylinder that, because it blocks out basically all of the X-ray radiation, just ends up looking like a rectangle. And then you have your cylindrical wood piece, and that should be a little more radiolucent on the sides, more radiopaque in the middle, just because it's thicker in the middle because the radiation is going this way. This is going to appear really similar to a root outline. We may notice that on the sides of roots, it gets really dark. In some cases, if there's too much radiation, it looks kind of washed out. And that's what creates our cervical burnout appearance. And so we'll show you what that looks like when we go through our caries lecture. All right, how about these radiographic images? Can you guess which is which? Let's look at these plaster of Paris and try to determine which is this Pac-Man looking with its open mouth. You'd imagine it'd be, where's it the thickest? That's where it should be the most radiopaque. So a little more radiopaque on the sides, more radiolucent in the center. That would be image E, actually. So that's our Pac-Man taken from the side or taken from above looking at this view. So what is this one right here? You should have a very sharp line distinguishing between this pretty radiolucent component, and this would be really a radiopaque. So that's D right there. All right, how about this rectangular cylinder? It should be fairly uniformly radiopaque, right, all throughout. The only one that really looks like that is B, and so this is B. And this one here that's kind of wedge-shaped, that's going to appear more radiopaque in the center. That's our C. And then this one we have another just typical cylinder. So the last one left here, A, as you would expect, more radiolucent on the sides where the X-rays are passing through less material, more opaque in the middle where there's thicker material to pass through. All right, and what do you think each of these is going to look like? Now we have just different thicknesses of cylinders. And is A going to look just as radiopaque as D? No, of course A is going to be less radiopaque. It's going to be more radiolucent compared to D. And then we're also going to show you increasing intensity of the beam. So whether we turn up the KVP or the MA or the time, that's all going to increase the amount of radiation. KVP makes an even more penetrating beam as well, so that'll have even a more exaggerated effect. But whatever we do, if we're increasing the intensity of the beam, it's going to have the same effect. And here's what those look like. As you would expect, that small one, you see more radiolucent on the outside, and then these ones are thicker and thicker. But basically, these look fairly uniform because it's blocking out most of the X-ray beam. And as you increase the intensity, this little small one appears thinner and thinner until it pretty much just disappears, because basically at this point we have such an intense beam, it's just blasting through that small cylinder of plaster of Paris and you can't see it anymore. And so different beam intensities are going to be more ideal for distinguishing different thicknesses of this plaster of Paris. And that's true for our imaging. Different beam intensities are going to be better for some patients than others. If they have thicker tissues, then you want a higher beam intensity. That's why in adults, we use a longer time typically, although you can adjust the KVP in some cases. But you've got to be careful because if you increase it too much, you're not going to see the material at all. And so the general rule of thumb with intraoral radiography is that you see a small, faint outline of soft tissue, then you haven't overdone it. And so the radiopacity of an object depends on a lot of different things. The type of material, as we saw the difference between plaster of Paris and metal and plastic, all those had different densities to them. But then also the thickness of the material. The shape of the object, as we saw with some of those plaster of Paris cylinders. The intensity of the X-ray beam used, as we just showed you on the previous slide. And the position of the object in relation to the X-ray beam and the receptor, as we talked about in our geometry lecture. The sensitivity and the type of image receptor. Some image receptors are a lot more sensitive to radiation than others. And of course, remember that a radiographic image is a composite of everything that X-ray is passing through. And so this doesn't show the soft tissue. Soft tissue doesn't attenuate very much, but it has passed through soft tissue, the bone, the teeth. Of course, we have canals in the bone. So we talk about the cortices of the bone, but then also canals have cortices, lamina dura around the outside of the roots. You see trabeculation inside the bone marrow. And then all that are just kind of joined together in this two-dimensional image. And so you have to be aware of where things lie three-dimensionally to be able to interpret it. And here's the same thing just shown in maxillary tooth. So here we see something new. This is the maxillary sinus. Because that's usually air-filled, it's going to appear very radiolucent. Here's an anatomical structure that you've got to recognize, the zygomatic process of the maxilla. And so you do need to recognize how these things look at different angles from different perspectives, and hopefully be able to identify anything in a radiographic image. What are you looking at here? Can you identify that? Maybe something that you use pretty frequently, but sometimes people have a tough time identifying it from this view because we're not used to looking at things in X-rays. What if we looked at it from the top down? Is that a little easier? Kind of ring-shaped here, a little handle coming off here. If we look at it from the side, that's your classic teacup shape. And so this is from the side, but the handle directed either straight at you or away from you. Hard to tell really, right? But from the side, we can really see that classic shape. From above, maybe that helped us identify it. Yeah, that's just a teacup. All right, what are we looking at here? We can see the skull. It looks like a Waters view, meaning the patient's head is angled upward, kind of backward a little bit. And we're looking into the nasal cavity. So is this dense object, which looks like it's metal, inside the nasal cavity? Well, just based on this view, it could be, but let's get a different view. And no, the nasal cavity is way up here, and this is in the skull base. This is a metallic aneurysm clip. So I hope that gave you an idea of how you see things. It's kind of a dance between your eyes and your brain. and that we don't always see everything that we think, and we only see things we recognize. And I hope that that gave you some practice in how things look in a radiographic image, which will help immensely in your interpretation of images in the future.